Every 40 seconds, someone has a stroke. But what many people don't know is that the body often sends warnings, not loud and painful, but subtle and quiet. The kind of warnings that get ignored, dismissed as just aging. For those over 60, recognizing these silent signs could mean the difference between full recovery or permanent damage. In this essential health alert from True Senior Wisdom, we uncover 6 subtle symptoms that might mean a stroke is coming, perhaps sooner than you think. These aren't the dramatic movie-style collapses. These are quiet whispers, and your chance to respond before it's too late. Sign number 1, sudden dizziness or loss of balance. We all feel a little lightheaded from time to time. Maybe we stood up too fast or skipped a meal. But if you suddenly feel off balance, dizzy, or unsteady on your feet without a clear reason, your brain may be crying out for help. Your brain needs a constant, steady supply of blood and oxygen. If that flow is temporarily reduced, even for a few minutes, you may feel off-kilter, lightheaded, or like the room is spinning. This isn't just vertigo. It could be a transient ischemic attack, TIA, often called a mini stroke. TIAs are warning strokes. They often come with dizziness, imbalance, nausea, and a sense of disorientation. These events may only last a few minutes and then disappear completely, but they are a crystal clear signal that a full stroke could be coming next. What to watch for? You suddenly feel like you might fall, even while sitting or lying down. You sway or drift while walking. You feel a strange floating or spinning sensation, even briefly. You grab walls, furniture, or hold on to others for stability. Your surroundings seem to tilt or pull to one side. You feel off balance even when your eyes are closed. Medical science behind the sign. The cerebellum, the part of your brain responsible for balance and coordination, can be particularly vulnerable to reduced blood flow. Even a minor clot or brief interruption of oxygen in this area can interfere with your ability to sense body position, disrupt coordination between your ears, eyes, and limbs, cause sudden episodes of vertigo or imbalance. According to the American Academy of Neurology, TIAs affecting the posterior circulation, the brainstem and cerebellum, often present without weakness or speech changes, making them harder to diagnose, but equally dangerous. According to the American Stroke Association, balance problems paired with dizziness are one of the most overlooked stroke symptoms in older adults, especially women. A review in the Journal of Neurology found that 1 in 3 seniors who had a stroke in the cerebellum or brainstem reported dizziness as their only symptom. Even more concerning, many of these patients were misdiagnosed with inner ear disorders or anxiety before the actual stroke occurred. Losing balance is frightening. It shakes your sense of trust in your own body. You may avoid walking outdoors or on stairs, hold furniture while moving around the house, hesitate to exercise or go out in public alone, feel embarrassed, vulnerable, or even ashamed. This withdrawal, while understandable, only increases fall risk, loneliness, and mental decline. But it doesn't have to be this way. What you should do: don't wait to see if it goes away. Record when the dizziness started, what you were doing, and how long it lasted. Seek immediate evaluation, especially if this is a new symptom. Ask for a neurological exam, MRI of the brain, and vascular imaging if symptoms persist or return. Insist on checking for TIAs or posterior circulation stroke, not just inner ear causes. Helpful prevention steps. Stay hydrated. Dehydration can mimic dizziness symptoms. Control blood pressure and cholesterol to reduce stroke risk. Get regular balance and strength training, Tai Chi, walking, core exercises. Avoid sudden movements from lying or sitting positions. Balance is not just about strength, it's about the connection between your brain, nerves, and muscles. When that balance shifts without warning, it's not your age. It's not your clumsiness. It's not nothing. It's your brain waving a flag. And your best chance at staying on your feet is to listen before you fall. Sign number 2. Blurry or double vision. You open your eyes in the morning and something feels off. The room looks foggy. Letters blur together, you rub your eyes and blink a few times, but it doesn't quite clear. Or worse, suddenly you see 2 of everything. One object becomes 2, side by side, as if your brain is unsure where to focus. Most people don't think of this as a stroke symptom. They assume it's their glasses, or eye fatigue, or even just poor sleep. But vision changes like this, especially if they appear suddenly, can be the brain's way of signaling something far more serious. Your vision is controlled by a complex network involving the occipital lobe, the brainstem, and cranial nerves. If a stroke disrupts blood flow to any of these regions, even briefly, your sight may change drastically. Unlike gradual changes from aging or cataracts, stroke related visual symptoms tend to appear fast, within seconds or minutes. They may include blurred vision in one or both eyes, double vision, diplopia, loss of part of the visual field, e.g., one half of your view suddenly goes dark, trouble focusing or following movement, seeing shadows or flickers. Seniors often attribute vision changes to glaucoma or macular degeneration, cataracts, eye strain, fatigue, dry eyes, but none of these conditions cause sudden, unexplained double or partial vision loss. If you're experiencing something that feels off with your eyes and it's not related to blinking or lighting, it could be your brain. A study published in Stroke 2020 found that up to 60% of patients with posterior circulation stroke experienced visual disturbances as their first symptom, and 40% of those were misdiagnosed at first contact because the symptoms were so subtle and patients seemed alert. Losing or altering vision, even for a few minutes, can be terrifying. Seniors often say, I felt disoriented. I didn't trust myself to drive. I was afraid to tell my family because I didn't want to worry them. This fear leads many to hide the symptoms or delay care until the damage is permanent. But the earlier you respond, the greater your chances of recovery. What you should do: don't ignore sudden changes in how you see, even if they last just a few minutes. Track when the issue occurred and how long it lasted. Ask for an urgent appointment with your primary care doctor or eye doctor and mention stroke concerns. Request a neurological evaluation, not just a vision test. Push for an MRI or CT angiogram, especially if symptoms were in both eyes or lasted more than a few minutes. Keep a vision journal if something feels different, even if you're unsure why. Avoid driving or operating equipment if your sight has changed, even temporarily. Let a loved one know. Don't keep it to yourself. Your eyes don't just show you the world, they reflect your brain's health. When your vision shifts suddenly, that's not just an eye issue, that's your brain. And it's asking you to pause, pay attention, and protect it. Don't brush it off. Don't wait for it to get worse. Your sight may just save your life. Sign number 3: difficulty speaking or understanding simple words. It can happen in the middle of a sentence. One moment you're speaking clearly, and the next, the word you need is gone. You fumble, pause, or say something that makes no sense. Or maybe you're listening to someone and suddenly it's as if their words are in a foreign language. Most people dismiss this as just a senior moment. But sudden difficulty speaking or understanding can be a sign of a stroke in progress, particularly in the left hemisphere of the brain, which controls language. Your ability to speak, understand, and process language depends on a finely tuned brain network. If blood flow is disrupted even briefly, that system can fail and your words may falter with it. This may appear as slurred or slowed speech, saying the wrong word entirely, e.g., cat instead of car, speaking in gibberish or unfinished phrases, trouble finding common words you normally use, struggling to understand simple instructions or conversations. Strokes that affect Broca's area, speech production, or Wernicke's area, language comprehension, can lead to aphasia, a condition where your brain cannot produce or interpret language normally. Even a small stroke in these regions can lead to receptive aphasia, hearing but not understanding; expressive aphasia, knowing what you want to say but not being able to say it; global aphasia, severe impact on both understanding and speech. And the scary part, it often looks like confusion, tiredness, or just being off. Losing the ability to communicate is terrifying. Seniors often say, I was trapped in my own mind. People thought I was confused, but I knew what was happening. I felt embarrassed and angry. This loss of voice, even if temporary, affects confidence, independence, and mental well-being. If someone suddenly struggles to speak or makes no sense, act fast. Use the FAST stroke tool: face drooping, arm weakness, speech difficulty, time to call emergency services. Don't wait to see if it gets better. Early treatment is everything. Insist on immediate brain imaging, not just observation. Even if symptoms disappear quickly, it could be a TIA, a warning sign. Language is not just a skill, it's a lifeline. It's how you connect to others, express needs, and protect yourself. When your words slip away, even briefly, your brain is waving a flag. Don't ignore it. Don't wait. Don't feel ashamed. Your words matter. Your voice matters. And recognizing the silence might just save your life. Sign number 4, constant fatigue or drowsiness. Everyone feels tired now and then after a long day, poor sleep, or extra activity. But when fatigue becomes persistent, unexplained, and doesn't improve with rest, it's time to listen more closely. Especially for those over 60, sudden or ongoing drowsiness could be one of the earliest and most overlooked signs of an impending stroke. Fatigue and drowsiness are symptoms that originate in the brainstem and reticular activating system, areas responsible for alertness and consciousness. If a stroke reduces blood flow to these regions, even temporarily, your ability to stay awake and attentive may suffer. This can present as feeling drowsy or foggy for no reason, needing extra naps during the day, struggling to stay awake during conversations, slower mental responses, or difficulty concentrating. Fatigue doesn't feel urgent. It doesn't seem dramatic, but that's exactly what makes it dangerous. A brain deprived of oxygen doesn't always scream. Sometimes it simply slows down like a computer lagging before a crash. A 2022 study in stroke and vascular neurology found that 40% of patients who experienced posterior circulation strokes reported excessive sleepiness or fatigue in the 1 to 3 weeks before the event. Even more surprisingly, many had normal blood pressure and no chest symptoms, making fatigue their only warning. Seniors often don't tell anyone they're tired. They don't want to complain or seem weak. But fatigue affects more than just energy. It impacts memory, mood, and motivation. It can signal problems with circulation, oxygenation, or brain inflammation. It increases fall risk and social isolation. The result? A spiral of reduced activity, poorer health, and rising stroke risk. What you should watch for: needing more naps than usual, feeling mentally foggy even after sleeping, trouble focusing on reading, TV, or conversations, slow reaction times or decision making. These aren't just signs of aging. They could be your brain slowing down in distress. What you should do: track your fatigue, time of day, duration, and triggers. Let your doctor know, even if it feels minor. Request an evaluation for TIA or silent stroke symptoms. Ask for imaging of the brainstem and posterior circulation if symptoms persist. Rule out contributing factors: sleep apnea, low thyroid, anemia, or dehydration. Gentle prevention tips: stay hydrated with water-rich foods and fluids. Engage in light movement, even 10-minute walks. Avoid sedative medications unless necessary. Keep a regular sleep schedule and limit daytime oversleeping. Tiredness may seem harmless, but when your brain starts asking for more sleep over and over, it may not be seeking rest. It may be seeking help. Your brain doesn't need to shout to deserve your attention. Sometimes it just needs you to wake up to what it's trying to say, because staying alert, truly alert, might be your brain's best chance at staying alive. Sign number 5, unexpected bleeding or bruising. Blood is a powerful communicator. It's also a warning light that many of us ignore. After age 60, unexpected bleeding or unexplained bruising is not just inconvenient, it can be one of the earliest silent indicators of an impending stroke or blood vessel issue. This sign is especially dangerous because it often appears in places we dismiss: gums, nose, urine, stool, or under the skin, and doesn't always come with pain. A stroke is essentially a disruption of blood flow in the brain, either from a blocked vessel, ischemic stroke, or a burst vessel, hemorrhagic stroke. If your blood vessels are weakened or inflamed, they may begin to leak, rupture, or fail long before a stroke occurs. Signs of this instability may appear in bleeding when brushing your teeth, not related to gum disease; blood in your urine or stool, even in small amounts; nosebleeds with no trauma or dryness; skin bruises that appear spontaneously or after light pressure. These aren't just signs of thin skin or aging. They could be your blood vessels signaling stress, fragility, or inflammation. What you might see: dark purple or brown bruises on your arms, legs, or back; bleeding from gums that won't stop easily; pink or red urine or rust-colored toilet water; small red or purple spots, petechia, that look like a rash; unexplained bleeding after minor bumps or no injury at all. Bleeding and bruising suggest fragile capillaries, and that fragility can extend to the brain. Conditions that cause systemic vascular inflammation, such as high blood pressure, diabetes, autoimmune diseases, blood thinning medications, can all quietly set the stage for stroke. A 2021 review in the American Journal of Medicine found that minor spontaneous bleeds or bruises in older adults were associated with higher rates of stroke within 12 to 24 months. People feel embarrassed by bleeding. They often don't tell anyone, but the silence is dangerous. It delays diagnosis, it normalizes something abnormal, it adds to shame and secrecy. What should be a red flag becomes just another hidden symptom. What you should do: keep a log of any bleeding or bruising, what triggered it, how long it lasted. Photograph bruises to track if they're growing or spreading. Ask your doctor for a full blood count, clotting factor evaluation, platelet function testing, brain imaging if accompanied by headache or mental changes. If you're on blood thinners, request a review of dosage and alternatives. Gentle prevention tips: maintain good hydration and vitamin C intake for vessel strength. Limit high impact activity if bruising increases. Use a soft toothbrush and avoid overly aggressive flossing. Reduce alcohol intake, which thins blood. Monitor blood pressure closely, especially if you have bleeding tendencies. Bleeding doesn't always scream. Sometimes it trickles in quietly, showing up in places you don't expect, asking for attention you're too tired to give. But that small red dot, that faint purple bruise, it may be your brain's way of whispering, "I'm not as strong as I used to be. Please help." Don't let embarrassment silence what might be your clearest early warning. Let small signs speak before they become irreversible. Because sometimes saving your life starts with noticing a spot. Sign number 6: chest tightness or jaw back pain. Chest pain is one of the most well-known symptoms of a heart attack, but it's often misunderstood in the context of stroke, and especially misunderstood in seniors. The truth is, many strokes are preceded by cardiovascular signals, and some of those early warnings can mimic cardiac events. What makes this sign especially dangerous is that the pain may not feel dramatic, and it may show up in unexpected places like the jaw, neck, or upper back. Stroke and heart disease often share the same root causes: high blood pressure, diabetes, inflammation, and vascular fragility. If your heart or arteries are sending distress signals, even vague ones, your brain may be next. Signs like tightness in the chest, discomfort in the jaw or back, or a squeezing pressure during light activity could indicate not only cardiovascular trouble, but, but also an impending stroke, especially in those with existing risk factors. What you might feel: a heaviness or pressure in your chest that spreads to your shoulders or jaw, a dull ache behind your breastbone, especially when walking or climbing stairs, a tight collar sensation around your throat or neck, discomfort between your shoulder blades that comes and goes, pain that feels like indigestion but doesn't respond to antacids. These sensations can be brief, mild, or even silent, but they're not benign. Women over 60 are far more likely to experience stroke and cardiac symptoms without classic chest pain. Instead, they may feel fatigue, mild nausea, neck stiffness, jaw clenching, back soreness. These symptoms are often misdiagnosed as anxiety, arthritis, or acid reflux, delaying life-saving intervention. Jaw and back pain may arise from referred pain, signals originating in the heart or arteries that travel to other parts of the body. In some cases, stroke affecting the brainstem can also disrupt signals related to cardiovascular function and pain perception, leading to odd or misplaced sensations. Additionally, people with atrial fibrillation, carotid artery disease, or a history of mini strokes may have impaired blood flow that causes these subtle warning signs. Don't ignore discomfort, even if it seems mild. Track when the sensation occurs: during stress, movement, after meals. Request a comprehensive cardiac workup: electrocardiogram, EKG, echocardiogram, stress test, carotid ultrasound, blood pressure and cholesterol screening. If symptoms persist or escalate, go to the emergency room. Don't wait for a full-blown stroke or heart attack. Pain in the chest or jaw is alarming, but subtle pain is worse. It's easy to dismiss, easy to justify, and that's what makes it lethal. Seniors often say, "It's probably just gas. I slept wrong. I don't want to bother anyone." But this avoidance, rooted in fear or politeness, can cost time, and time is brain. Pain is not always a shout. Sometimes it's a whisper, a nudge, a suggestion. If your body is asking you to slow down, listen more closely, or seek help, that's not weakness. That's wisdom. Pain is never pointless, and neither is your life. You've carried your family, your memories, your strength for decades. Don't ignore the message now, because when you listen early, you get to stay longer. By the time we reach our 60s, we've learned how to carry pain quietly. We've gotten used to adapting, adjusting our pace, masking discomfort, blaming time for everything we feel. But the truth is this: your body is not betraying you, it's communicating with you. The signs we explored, from fatigue to confusion, from bleeding to breathlessness, are not just symptoms. They are love letters, whispers, warnings, and if you ignore them, they grow louder until the whisper becomes a scream. But you don't have to wait for the scream. You can pay attention. You can speak up. You can protect your life before it becomes an emergency. There is wisdom in your age. There is power in your noticing, and there is hope in every small choice to care. If one of these signs resonated with you, don't let fear or guilt delay your action. Make the appointment, ask the question, get the test, tell someone, because healing doesn't begin at the hospital. It begins with awareness, with listening, with honoring the truth your body already knows. You are not too late. You are not too far gone. You are not broken. You are worth the care. You are worth the checkup. You are worth the second chance. If this video helped you, please like the video, share it with someone over 60, comment below. Which of these signs have you experienced? And don't forget to subscribe to True Senior Wisdom, where every sign is honored and every life after 60 is still sacred. Stay safe, stay aware, stay alive.